So one very important and technical point when we talk about the implants in total hip replacement surgery is to basically differentiate between the implants. So the broad division you can classify between two types. One is called cemented total hip arthroplasty, second is uncemented total hip arthroplasty, and there is a combination also which is called hybrid. So what is the difference? In cemented total hip arthroplasty, basically cement is used to form a bond between the implant and the bone, whereas in uncemented total hip arthroplasty, no cement is used and the bone growth takes place over the implant over a period of time. So we are not using any cement as a bond or something to fix the implant to the bone. The hybrid type, basically it means that on one side we do a cemented implant and on the other side we do an uncemented implant. So who is a candidate for cemented hip? Who is a candidate for uncemented hip? And who is a candidate for hybrid hip? Now your surgeon, your physician, your doctor, treating doctor is the most important person who will decide about this, who will take a decision regarding what kind of implant would you need. But generally speaking, uncemented total hip implants are preferred in younger individuals because it is thought that the longevity of uncemented hip implants is more as compared to cemented hip implants. But again, this is not a very fixed criterion. There are certain centers and certain surgeons who do cemented hips in young patients also. So basically, let your surgeon, let your physician take this call. Let him decide what would be best for you, the cemented hip or the uncemented hip.